Hello everyone. Quick question for you. How many of you have struggled to quickly identify different types of hyperlipidemia, like where we get eruptive xanthoma, where we get tendon xanthoma, where we get tuberous xanthoma? So today I'm Dr. Shabab and we are going to break down the hyperlipidemia in a way that is simple, high yield and easy to remember. By the end of this session, you will not only understand it clearly but also be able to apply it confidently in real cases. So let's get started. At first, the first type is type 1 hyperlipidemia. Another name is chylomicronemia syndrome. Here we get the TG, triglyceride is increased. We get eruptive xanthoma. We will see the picture of eruptive xanthoma in a while. In the history, they will say they are having recurrent upper abdominal pain. Sometimes they will also say that familial history of abdominal pain also present. If we look at the cause is decreased lipoprotein lipase. So how will we manage the case? We will manage the case with fibrate. As TG is increased, for increased TG, we always use fibrate. Now come to the eruptive xanthoma. See, this is the eruptive xanthoma, where we get the xanthomas distributed all over our body. Now come to the second part. This is familial hypercholesterolemia, also known as type 2. In this case, we have familial history of early CVD death. Means their father, brother, or grandfather will have death in an earlier age due to the cause of CVD. And here, what will we get? We get tendon xanthoma. We will see the picture of tendon xanthoma. And what is the diagnostic criteria of familial hypercholesterolemia? So, if you do investigation, on the investigation, the total cholesterol will be more than 7.5 millimole per liter and LDL-C will be more than 5 millimole per liter. So, what is the cause? The cause is LDL receptor deficiency. So, how will we manage this case? As this is increased cholesterol. So, for increased cholesterol, we always use statin. And for increased TG, we use fibrates. And when you are using statin, so it should be discontinued 3 months before conception. So these are the pictures of tendon xanthoma. See, the xanthomas are present over the tendons. Here over the tendons, here over the tendons. Okay. And this is the xanthelasma. This is a very common case in our practice life. Now come to the next part. This is familial combined hyperlipidemia, also known as type 2B. In this case, the ApoB100 increase and the LDL, VLDL, TG, all these three will be increased. And what will we get? We will get the history of premature cardiovascular death. And what will be the treatment? The treatment will be atorvastatin. So the last type, this is the remnant hyperlipidemia, also known as type 3. Also known as dis-beta lipoproteinemia. Here we get mixed hyperlipidemia, like the cholesterol and TG both will be increased. So what is the cause? The cause is ApoE2 homozygosity. And what will help us to diagnose the case? This is Palmer xanthoma and tuboeruptive xanthoma. So where we will get the Palmer xanthoma? Palmer xanthomas will be present as yellow discoloration over the palms. And tuboeruptive xanthomas is usually present over the high pressure areas like elbow, knee. And what is the association? It is always associated with diabetes mellitus, obesity, hypothyroidism, alcohol. And what is the management? You can see here cholesterol and TG both is increased. So, what will be the management? The management is fibrate. Cause most of the cases TG increased more than cholesterol. That's why we use fibrates here. Now let's see the picture of Palmer xanthoma and tuberous xanthoma. So you can see the tuberous xanthoma are present over the pressure areas like elbow, and also you will get over the knees. And let's see the picture of Palmer xanthoma. It's present over the palmar crease. So we have learned so many xanthomas. Let's do all the xanthomas in one picture. So here you can see that the ash colored dots are indicating eruptive xanthoma. So these are present in all over the bodies. Now come to the tuberous xanthoma. It presents over the high pressure areas like elbow, knee. And tendinous, this presents over the tendons. Okay. So I think up to this, now we will able to diagnose the xanthomas in a very easy way. And I will try to present in another case in a easy way. Till then, take care. Thank you.